So today I've got, as I continue to interview interesting people throughout Whatcom County, I have somebody I've been excited to interview for quite a while, and the topic today is hormones. It's a fascinating topic because it really plays into a lot of things in society, from how you feel, how you react, how you think even. It's a big deal, and especially as we get older into our 40s and 50s, this is something that both men and women really need to understand, because especially for women, when we get into that stage where they start to get, whether it's perimenopause, that kind of thing, it can cause some problems for relationships, and even for the person that's going through it. So I'm excited to have with me today somebody who's an expert on it, Dr. Brenden Witte. Doctor, welcome.
Thank you. It's so great to be here.
So tell me, what actually is your official title? Are you like hormone doctor, or is there another word for it?
Oh, it's a great question. So I'm a naturopathic physician. Naturopathic physicians, we ask why. Why does the patient have the symptoms that they are experiencing? When I work with patients, I'm always asking this question. It's one of the first things when they come in. We treat the cause. So we do our best to evaluate and make sure that we understand what is causing the dis-ease, and then treating that specifically. An example, a person can have a headache without their body being aspirin deficient. Your body doesn't need aspirin. That's not why a person has headache. The aspirin's great, and I certainly don't want patients to suffer, and the aspirin helps relieve the pain. But if you have the wrong glasses prescription,
right,
doesn't matter how much aspirin you take, you're going to continue to have headache. Dehydration, potassium deficiency, all the different things. There's many causes for headache. And again, the aspirin's helpful. But if you just take aspirin, if you just keep taking the aspirin, it's not going to treat the cause.
Man, and with today, with the whole thing with ibuprofen and quite frankly, big pharma, we're learning lots about how big pharma hasn't been our friend necessarily. What are some of the detrimental effects of taking things like ibuprofen for too long?
Oh, so especially my contractors, my guys are beating themselves up all day long.
That'd be me.
And so, so it just makes sense. I'm in pain, so I'm gonna eat handfuls and handfuls of Advil and Tylenol all day long. This is not sustainable. Just absolutely is not sustainable. The NSAIDs, things like ibuprofen, Advil, these are very hard on the kidneys. So chronic, high dose, chronic use, it's going to cause problems for the kidneys. And I've had a couple of guys, beginning stage kidney failure, just handfuls and handfuls and handfuls of ibuprofen all day long.
Really?
It's not sustainable. So there are ways to help to support the body with recovery, so that the patient isn't always in pain, and just with the understanding that life beats us up.
Isn't it, that stuff, after a while, starts to lose effect a little bit too, doesn't it? After taking tons and tons of ibuprofen, you have to take more, or is that?
I would offer this: instead of working with the body's natural ability to recover, many pain relievers are actually inhibiting this correct process. So I know inflammation has been criminalized. There's reasons why inflammation has been criminalized in our current society. We actually need inflammation to set a foundation. So if you tear down a building, you don't just immediately start building on top of the rubble. You have to move the rubble out of the way and have a good, clear foundation. That's essentially what inflammation is supposed to do. It triggers the body to come in and remove the rubble so there can be this correct healing. It's a little bit of a painful process, and so the pain signals that are coming in during that process, the NSAIDs, Tylenol, and so on, they prevent that process. So now we don't have a good foundation, and now the body's trying to build on top of that rubble. It leads to more injury.
Interesting. And so you mentioned in the opening that you are naturopathic as opposed to allopathic, and maybe sometimes psychopathic, some of these so-called doctors out there these days. So, which they then, in my understanding, means you're looking for more natural remedies before you go to pharmaceutical type things. Like, for example, supplements. Tell us a little bit about an example of somebody, let's say, is having, like me, I had talked to you about chronic shoulder pain from like arthritis and inflammation, and you told me about something called, I believe, BPC 157?
157,
Yeah.
that is correct. So everything that I do at the clinic, my entire practice, the goal, I'm asking how can we support excellent normal function of the body? The pharmaceuticals have their place.
Sure.
I certainly don't want to poo-poo.
Yeah.
Each physician has to make their own clinical decision and with what they know. But again, we're trying to help the body in its excellent normal function. If it's functioning excellently normally, it's not going to be in chronic pain.
Right.
You're not going to have this massive inflammation that is just completely aberrant. So BPC 157 specifically is a peptide. Peptides have recently come onto the market. They are the future of medicine. They're different from hormones in that hormones are large molecules that can affect all the systems in the body. And it is important for them to be in good range. Peptides are very small molecules with very specific action. The BPC 157 specifically is triggering connective tissue to come back and repair correctly.
Is this similar to what stem cells do?
So a little different mechanism. Stem cells are coming in where there's a deficiency, and they're undifferentiated cells. They're cells that can become kind of anything. Mm-hmm. So if there's a deficiency of the ability for the cells to heal in a particular area, the stem cells are able to come into that area, differentiate, and become that tissue, causing repair.
Interesting.
The BPC is triggering existing cells, and for whatever mechanism, just the toxins in our environment make it very difficult for the cell signaling to be correct. The inflammation is not allowing the body to come in and do that healing correctly. Again, so the BPC is just asking the connective tissue, so bone, ligament, tendon, joint, muscle, and skin, to do that correct repair.
Right. And so you're always looking for, obviously, because of the nature of your naturopathic medicine, looking for the natural solution before someone has to go to allopathic medicine or pharmaceutical, which I personally have discovered I always try to go the naturopathic way, because I find in most cases that there are things and ways that I can heal myself if I just give it enough effort and time without medicine. That's why I'd mentioned like stem cells. I know there's people that they're going to Mexico now because it's so ridiculous and expensive here. Plus here, a lot of times they're not using great stem cells and stuff there. So you look at the natural way to do things. Let's jump in now a little bit to hormones and how that can also, obviously, we joke a lot. I know that my fiance and I have personally dealt with this. She's gone through recently perimenopause, and there was a time when we weren't quite sure we were going to make it because we were, and I kind of understood what was happening, but she didn't. She even though she knew that, okay, I might be getting into this phase of life, man, the stuff going on, just, there was times when, and I hope she doesn't kill me for saying this, but she would lose her mind. And I'm going, this is not who you are. This is not the person you are. I know this. Something's wrong. You're not mentally ill. You're not crazy. So, yeah, what are your thoughts on that? Tell me a little bit about how that plays in.
Ooh. So it's a big question. And let me just be very clear, setting an intention here as we talk about relationship.
Sure.
I truly believe that the sexes have been pitted against each other.
Sure.
The goal of everything that I'm about to talk about is to help mend that gap. Truly, the feminine should be supporting the masculine as the masculine protects and supports the feminine.
Absolutely.
And round. So I'll try not to get into trouble with some of the things that we discuss. It all comes from a place of really wanting to help men and women come back together.
Well, because men deal with it too.
Absolutely.
So.
Yep. So there is a relationship with the hormones and brain functioning. Actually, as patients come on to treatment, men and women, I do caution them with anxiety and depression medications, even ADHD medications. As the testosterone comes on board, as the hormones come on board, the brain functions much more normally, and they don't need those medications. Almost all the patients are able to back off. Most of them are able to come off of those medications. So it's really, really important that we have adequate hormone just for normal brain function. Perimenopause specifically, the woman's body is not able to produce enough estrogen. And with this lack of estrogen, there can be a lot of brain fog and really a feeling of being overwhelmed with just 2 or 3 things in the day. They don't have the same chutzpah, they don't have that same fervor. Truly, I think estrogen is a superpower for women. It allows them to accomplish many things and just supports this excellent function, this chutzpah.
But there's a balance, right?
Exactly. And so not enough and way, way too much is incredible for their body. And it really, like you said, so I've had female patients report that there were times when it was like they were watching themselves and they could not stop themselves. Just the massive swing, the massive fluctuation in estrogen specifically made it extremely difficult for control.
So when perimenopause starts to set in, what is the typical out of balance? Is it more testosterone or more estrogen?
So I'd offer men and women too much estrogen. There's going to be either an emotionality or an irritability, and that can translate to pretty quick temper. For menopause specifically, just the body's not producing enough estrogen. And the brain's signaling for more. The brain starts screaming for more. We really need this estrogen. And suddenly, the ovaries, the body ends up releasing massive amounts of estrogen. So we're talking about massive swings in this hormone. To kind of put it into a little perspective, when I work with guys, we do focus on balancing estrogen. Arguably, it's the most important part of treatment. But it's a fairly narrow range, and just generally, most guys are going to be in the 20 to 30 range. If they're going much above or below, there can start to be some issue, whether more irritability and emotionality. On the flip side, if it's not enough estrogen, guys need some. This is not testosterone for guys, estrogen for women. Guys need both, women need both in good balance.
Just real briefly for our audience, when you mention these numbers, what do these numbers represent?
So I do lab work, checking in on levels for patients. The labs are just a guide. The numbers are just numbers, but they can help to guide treatment, making sure that there's adequate hormone and staying in good balance. So.
What is a typical good or normal number for a woman to be at for estrogen as opposed to testosterone?
Yeah.
Or does that vary?
It is completely different for each body. Okay. One of the things that has surprised me most working with women, and it's been not quite a decade now that I've been working with women, it's the tremendous variability in what is appropriate for that body. We have patients where our lowest dose for the estrogen is still too much. It's still too much. And I have patients who are 30 times that amount. And I think I'm feeling it. So it's super, super individual. It's very, very diverse. I think it's part of the reason that medicine has struggled with women's hormones for so long. Just, it really is quite diverse.
Well, I joke about a couple things that I wonder how many women are in prison for murder because they just needed their hormones adjusted, lost it. And it's funny, but it's not. It's like, it's a thing.
It's a thing. No, yeah. It's a really important.
And I'm not saying that guys aren't knuckleheads. I talked about that with my fiance. That yeah, I know. I'm a knucklehead sometimes. So, but it's how you deal with those situations. Whether it's an argument about something or whatever, as guys, as we sit back, especially watching our significant other, we notice that one day we can say something and 2 weeks later we can say the same thing and it has a totally different response.
True.
It's like alcohol.
Yeah.
Alcohol can make you really happy, too much of it, or really mad.
And ultimately a completely different person.
Right.
And so there is some caution here. There are going to be times with some of these massive swings where that individual becomes a completely different person. And just general numbers wise, guys have this pretty narrow range that's pretty good for them. As they start to get a little bit outside that range, they start to notice it. For our female patients, the range, there's a 500-point variance in the range, and that's considered normal.
Wow.
And then you start looking at numbers in pregnancy, and we are into the thousands, sometimes even tens of thousands level. Women's bodies are phenomenal when it comes to their ability to deal with hormones, hormonal fluctuations and swings. But understand there can be these massive swings.
Do you treat pregnant women too?
So we're not considered a fertility clinic necessarily,
Okay.
but it should stand to reason as we bring back excellent normal function of the body. Procreation is a normal function.
Right.
So we do have a lot of success stories, both men and women.
Excellent. Yeah. Well, I noticed it's made a change in my life, and that one period of time when I went without, I started feeling irritable. I started feeling depressed, and that's the other thing too, is I'm not just picking on women. I mean, that's kind of the ongoing joke, but it's a real thing for guys too. I have gal pals who have significant others that they can't figure out it's almost like they're the ones that are the moody ones. It's like 1 minute they can say something, next minute he's just, and then as soon as they go on testosterone therapy, things start to level out,
Especially through this clinic. So it's really important to distinguish, for this clinic, it's not just about increasing testosterone. Most guys are going to benefit by increasing the testosterone, bringing it into a more appropriate range. But it's really important to have that balance. So men and women convert their testosterone into more and more estrogen. So just adding more testosterone, there's going to be this imbalance. It doesn't improve the ratio of testosterone to estrogen.
Is that where you hear about guys, bodybuilders getting roid rage?
Exactly, yes.
That's just an imbalance of estrogen.
Correct. Yep, in my humble opinion.
Sure.
Yes,
Okay.
yes. Please understand, the type of treatment for this clinic is nothing even remotely comparable to the things that guys are doing in the gym or whatever patients are doing in the gym.
You're not a performance enhancing clinic. You're about balance and naturopathy. Yeah.
Excellent normal function, more normal.
Right.
More appropriate levels for the hormones.
But when you're in balance, you does perform or does enhance performance just naturally.
Normal function of the body is being able to respond to the effort you're putting in the gym. Absolutely, yes.
How many, you have more than just one clinic now, is that my understanding?
Ooh, yes, so we've been able to open a location there in Issaquah. So I've got Dr. Trinka working for me there in Issaquah. He's doing a great job. We also have a location in Bellevue, although there's not a doctor's office. But we are doing all the recovery services. So the clinics, we're trying to make sure that there's cryo and sauna, so the benefits from cold and hot, as well as the IV therapies. We're doing vitamin, mineral, nutrient infusions for folks, helping replete, helping make sure that there's plenty of the various nutrients.
Who do you treat more with that, men or women?
Oh, great question. Location-wise, I'm trying to think if there's a difference between the sexes location-wise. I think it's across the board. It's possible that our female patients may be a little more focused on taking care of themselves. There may be just a little bit more social media around IVs and nutrient shots for females. But we have a fair number of guys coming in taking excellent care of themselves as well.
What does that entail, one of these treatments?
So, forgive me, but I'll talk about the Dr. Witte super.
Yeah, please tell us.
So Dr. Myers sort of really discovered and really ran with the idea that nutrients help. If we can infuse it directly, it's going to help even better. And it did. So Myers came up with a formula called the Myers cocktail. It's a good amount of vitamin C, magnesium, calcium, B vitamins, and so on. The Dr. Witte Super is the Myers cocktail souped up. It's more vitamin C, it's more magnesium, more calcium, more of the B vitamins. There's some amino acids thrown in there.
And when should you do this?
So there's many benefits by providing this nutrients to the body indirectly. So part of the reason for doing an IV version, I mean, you can take all these things orally, but it's going to be difficult to get the sort of gradient, to get the sort of levels.
Absorption.
The absorption into the body.
Yeah.
We're bypassing all that absorption hassle by putting it in directly. And we can also make that gradient much more potent. So physiologically, just trying to get nutrients and so on into the cells, it requires a gradient. So having it being much more potent coming into the body, it's going to drive that nutrients into the cells where it needs to go. So there's many benefits to doing this via IV as opposed to trying, not that there's not benefit to continuing supplementation orally, but there's good benefit doing it via IV.
Here's another one I'll ask. Sleep. Sleep seems to be one of the biggest issues today, especially for women. I don't know why. I mean, guys deal with it too, but it seems to me women, and I'm assuming partially some of that other than external factors. Obviously you've got external factors, but then you do have this hormonal changes that they're going through. What do you find to help?
This whole podcast itself.
Oh well, give me the best you can.
So real quick for female patients, especially during peri and menopause, the hot flashes are going to happen at night.
Yeah.
Keep in mind, so the average length of time for hot flashes for women is 7 years.
Wow.
Have I had patients report much less and much less detriment from hot flashes? Sure, but I've also had patients come in who are like, I've been having hot flashes for 14 years, doc.
Did you hear that, guys? Now you know why women are kind of uptight sometimes. You know, they're not getting sleep. I mean, and that's part of this too, is I want guys to understand that, hey, your wife's not crazy. She's just going through some stuff that I want, and that's part of the reason I do this interview. I want men as well as women to understand this dynamic that's going on that can be treated.
Yep. And please, guys, please have compassion for your spouses. If this little blip for us makes us feel pretty unpleasant, you have no idea. It is even the tip of the iceberg for what she's dealing with.
Right.
Truly. Please have compassion for them. There are going to be times where they may not have control. Find a situation that's safe. I mean, so please be safe in the situation. Find some distance, whatever it takes. Eventually things will settle down and calm down, but just understand these massive swings in hormones.
So what do you do as far as sleep? Do you have anything else besides just hormone treatment? Is there anything that you recommend, program or?
So for women especially, so if we can provide some estrogen for the body, that's going to go a massive way to help avoid the hot flashes. So that alone will allow them to sleep better. Estrogen is only part of the equation. We really need to make sure that it's balanced with progesterone and that there's adequate testosterone.
Now, where does progesterone play into this? What's the difference? You got estrogen, progesterone, testosterone. These are the three we're kind of dealing with?
Big three, yes. So I mentioned before, estrogen, it's like a superpower, but too much is way too much.
Right.
So it needs to balance with the progesterone. Progesterone is sort of the counter to estrogen. If it's too much estrogen, there's going to be fluid retention, this emotionality and irritability, menstrual type bloating and cramping. Progesterone comes in and it puts the kibosh on all of those symptoms. It also, if we're taking it orally, it also has the benefit of improving sleep. Sometimes the most profound change for women that we work with is the quality of sleep.
Excellent. What are the different delivery methods of this?
So hormones for our female patients especially, I strongly encourage doing subdermal pellets.
Right.
So it's the bioidentical testosterone is compressed into kind of what can look like a grain, maybe 2 grains of rice for our female patients. It is a small surgical procedure, so the pellets get put in the dense connective tissue, either of the glute or the flank.
Okay.
The benefit with this is that the levels come up, and then the hormones are very, very, very consistent. And for most female patients, it's going to be for about 3 months. So they don't have to try to lather and slather with a cream. They don't have to try to do injections and so on. The pellets, I've been really impressed at how effective the pellets are for our women.
And is this like a time release, slow release kind of a thing that gradually depletes or builds up or?
Yep, so it sounds like time release. Instead, it's based on blood flow, which is kind of cool. So as patients are exercising and working out, more blood flow, sure enough, more hormone when the body needs it. So it's a pretty cool delivery system, but if you're running marathons, they'll go through the
Deplete
pellets
pretty
a little
quick.
faster.
And you recommend working out at some level.
Absolutely. The best way to get the most benefit from treatment is exercise.
What does exercise do?
So humans have been active since humans have been around. It's really important. And even something as simple as walking. I know a lot of people poo-poo walking. Well, that's not really exercise. Are you kidding me? No, it's some of the most incredibly beneficial exercise. Women, especially with the estrogen on board, but women can have sometimes a 2-inch increase in their height just from walking several miles, several times a week.
Really?
That motion, that light impact on the bones are going to respond to the forces put on them. And especially with the treatment, especially with the estrogen on board. But yeah, those bones are going to remineralize with that activity.
Speaking of that, that makes me think of a question I want to ask. So what about deficiencies? Iron, calcium. Is this something that women deal with a lot more than men?
So the short answer is yes. And it's for many various reasons. Iron has to do with the body's ability to bring it in, which is very slow. And then the rate of loss. So for women who are having regular menses, and especially in our modern environment, the toxins are called xenoestrogens. They act like estrogen in the body. They're going to make PMS and the heaviness of the bleeding worse. And then stress definitely drives up estrogen levels. That's going to make the bleeding worse. It's going to lengthen the time of menses. So instead of 1 or 2 days, it can be an entire week of bleeding very heavily. So we deplete our iron stores with this. There are ways to bring those back. We do iron infusions here at the office as an example.
Oh, okay.
But ultimately the treatment is making sure that we have regular and appropriate menses. So we're not bleeding all the time and bleeding an appropriate amount. So iron is definitely can be deficient. Calcium is an interesting one. Our society really focuses on being thin. And thin to an inappropriate level. So instead of our women, when they're building bone, focusing on nutrient status and mineralization status, instead they're trying to be as thin as possible, trying to meet some sort of societal expectation. And so I don't know that women are able to get the nutrients in that they need.
Well, and I know even for my significant other, she's just so on the go, and then she forgets to eat, and
Absolutely.
you got to get that nutrients in there.
Absolutely.
Let's talk a little bit, if you don't mind, about supplements and things that you might recommend. Like, I know for certain that there's a lot going on, like, vitamin D3, K2, vitamin E, curcumin. What are some of these? What do these things do? How are they beneficial to us?
So, full transparency, there are clinics and they will send you out the door with a couple $1,000s worth of supplements every month. That has not been my approach. It is important to supplement, especially if there's a deficiency. And there are some things that we're just all deficient in. In the Northwest, especially in the Northwest, I would say everybody's going to be vitamin D deficient. And I say D as in daylight, because daylight can help us to produce some vitamin D. At the right, is it longitude, latitude? So with enough sun, we might be able to get the vitamin D that we need. Most of us in the Northwest, though, we're vitamin D deficient. And I'll have patients use an A, D, and K supplement. They're all fat-soluble vitamins. We need A and K. They do synergize with the effectiveness and help benefit with the vitamin D. So I do make a recommendation for this for almost all patients. It's pretty individual, though. If there's deficiency, I try to treat the deficiency. Otherwise, I'm a little cautious to say, oh, everybody should just take all these supplements and spend thousands and thousands every month.
Well, and that gets pushed a lot in naturopathy. Traditionally, it's like, I mean, you've got, but at the same time, so it's sort of almost like the flip side of allopathic medicine, which makes me think of, I worked in a rest home for just a short bit as a maintenance guy. And man, I tell you what, doctor, watching these old people sit there with these trays of medicine that come out, and one medicine is for one thing, and then there's another medicine to counter the side effects of that medicine and so on. I mean, they'll have 20 bottles of stuff, and I just wonder, which leads into, what about people over the age of 70? I mean, can they still benefit from hormone treatment, or is it too late?
Ooh. We've been dancing around it just a little. You've alluded to the idea that, men as young as in their 40s should really be paying attention, men and women. The thing that has surprised me most doing this work, Mark, is the age of my patients. I have men and women who are coming into the office age 20. Really? 20. And a fair number, an unusual number, I would say, who are in their 20s. When we look at their levels, they are miserably low. I mean, there's a reason why somebody who should feel invincible is coming in to see Dr. Witte. When they come in, they're not saying, oh, my hormones are low. They're saying, oh, Dr. Witte, I'm getting older, I'm getting older, I'm getting older.
In their 20s.
And they're 20. So obviously it's not age-related. That's not age-related decline. That's not what they're experiencing.
Why do you think that is?
Oh, my best explanation is all the environmental toxicities. I really try to encourage my patients to think about this. Our society has we've toxified our environment intensely. Heavy metals, lead and mercury, especially in the Northwest, flame retardants, and these are important things.
Sure.
But flame retardants are endocrine disruptors.
Oh, okay.
Plastics, don't even get me started with plastics.
Yeah, oof.
All of that food.
I'm like, I should be in stainless steel.
Almost everything that we're putting in our body seems to be wrapped or packaged in plastic. Even things like Gore-Tex. What a clever technology.
Really?
But Gore-Tex is an endocrine disruptor. They expect you to wear that Gore-Tex.
There's a lot of that around here.
And especially in the Northwest where it rains all the time, right? They expect you to wear that jacket once, maybe twice a year. We're in the Northwest. We're wearing that jacket 9 months out of the year. And we have the Gore-Tex hat, the pants, the socks, the underwear.
Interesting. I wonder why that is in Gore-Tex. Something in the chemical process?
Right, exactly. It's just, it's a clever technology, but the chemicals, and it's not the one chemical that's going to get you, but the soup that we live in. It's really at a point. Our 20-year-olds are really the canary in our very toxic coal mine, if you will.
And what about diet?
Concerning.
I'm assuming that plays into.
So absolutely, diet's definitely a component. I would offer, though, in my experience, my patients who are coming in their 20s, they know something's wrong because they're taking such excellent care of themselves.
Oh, okay.
And their body's not functioning correctly.
Interesting.
So cadets, EMT, military, border guard, these are young people who are physique trainers. I mean, these are folks who are in excellent shape as best as possible. And their body cannot produce adequate hormone.
Wow.
Yeah.
Wow, what a change. That's amazing. Yeah. It is different these days. There's something to it, and that's the question, what is it? And I mean, I agree with you that we are so, with the advent of all these conveniences, plastic and the processes that can be done so quick, I think we perhaps are overlooking the chemicals that are going, just like our foods and the GMOs. I mean, we're putting steroids and stuff because we want to make chicken breasts bigger, so you get these great big chicken breasts. That's not, I don't buy those anymore. I stopped buying them because that's not normal.
That's not normal.
A giant, I'm sorry, I grew up on a hobby farm, and we used to raise and butcher chickens, and I tell you what, that's not normal.
That's not normal.
So
Yes.
something right there tells you we need to take a look at these things. And in everybody's hectic life, we just, and I still do it sometimes, man. I'll find myself going through Jack in the Box late at night after having a few cocktails, and then the next day I wake up going, what did I do?
Why did I do that?
Right.
And we do our best with what we know.
Yeah.
This is not from a place of any sort of judgment.
Sure.
And truly, I jokingly say, hey, if I could, I'd write a prescription for you to live in a plastic bubble, right? And just try to avoid all the toxins.
Glass, not plastic.
But that's the thing, it's a plastic bubble. Exactly. So it's not going to help. You're not getting away from it.
Right, yeah.
Yes.
So,
So on the flip side, then, so I have my 20-year-olds who are very, very surprising. Their levels are miserably low. We go through a process to try to help their body start to produce adequate levels for them. Well, so I have 90-year-olds with active, healthy sex lives. I mean, they're skiing and they're playing tennis and they're doing all the fun things.
Yes, there's hope for me.
They give me great hope.
Right? It's like you're like watching your own experiment in a sense.
Right.
It's like,
Right.
hey, this is working. All right, there's hope for me.
Well, all we're doing is providing for the body what it needs. And it continues to function excellently.
What are you seeing in people that are in their 80s and 90s coming in? I mean, are they just really low, or and then how are they doing afterwards?
It's a double humped camel. And what I mean by that, so my younger patients, they're going to feel miserable with really low levels of hormone. My older patients, though, and probably their levels have been in the 2,000 range or whatever appropriate range for them. And now that they're in the 500, 600 range, they feel miserable. It's not enough hormone for their body.
Really?
Because they've had such higher levels their whole life. They didn't have to deal with all the toxic environments.
Right. So what is so a guy like me, I'm 56, and you know me because I'm one of your patients. What do you recommend? What do you like to see my levels at?
So it is pretty individual. Generally, though, the range that I'm using for testosterone, it's not the lowered reference range. So I've been doing this a long time. For years and years and years, the 350 to 1200 range has been appropriate. And ultimately, that upper quartile, the 900, 1200 range,
right.
most of my guys, that's where they're going to get their best benefit.
Right.
I do have a couple of patients who, the more 700, 800 range, more mid-range on that reference. The mid-range seems to work a little better for them. My older patients, I usually will be a little more cautious. Just their body doesn't get rid of the hormone as quickly. And so I usually will sort of target for that midpoint for them.
So for a guy who has low T, what does that do for brain function?
On many, many levels, there's this deficiency. The way that I explain it, the body responds to the testosterone level. So over time, we get more and more exposure to the toxins. The cells that are supposed to be producing testosterone for us can't. The levels go lower and lower and lower. And essentially, the body doesn't have what it needs to be able to respond and function normally. So brain function, especially not depression. Most of my guys can't put their finger on the depression button, but they definitely don't feel normal. They don't have the same interest and desire.
What about ADHD?
So if I may be so bold as to tell a story, I had a patient in his later 50s who got a recent diagnosis of adult ADHD. And as they were getting started with him, as they were going through the process with him to find the right dose, I don't know how, but he was on something like 40 milligrams of Adderall 4 times a day. This is a massive amount of stimulant.
Yeah.
But it seemed to bring some sense of normalcy for that patient. As we got started with treatment, I said, you be very careful. You're going to need less. Your brain's going to function much more normally with the hormone on board. You're not going to need so much stimulant. You be real careful with this. Sure enough, in about the first 6 weeks, we come back and do a lab review, and he's like, you were right, doc, 10 milligrams once a day.
So by doing testosterone treatment, you lowered the level of Adderall that he needed to take.
because his brain was functioning much more normally. Was he still ADHD? Did he still find the Adderall as a valuable tool? Sure. But instead of needing massive amounts to get the type of benefit that he was looking for, his brain was functioning much more correctly, and so just a normal amount got him the benefits he was looking for.
And I'm assuming the same thing with women.
Absolutely. No, absolutely. And for anxiety and depression medications as well. It can be way more nuanced than this. Again, I don't poo-poo these medications. They can be valuable tools, but ultimately, as we continue working on underlying cause.
So SSRIs, for example, I mean, obviously, I would think hormones can play into whether you even need those.
I have two patients who stand out in my head pretty distinctly, completely unrelated, but they came in the same week, and they both started very similar treatment. Within the first week, both of them had been doing, had depression essentially lifelong. Both of them had been doing talk therapy 40 and 45 years. In the first week after starting treatment, and this is not an expectation, this is...
Sure.
But both of them came back and said, "Doc, my depression's completely gone."
Wow.
Yeah. Is it like that for every single patient? That's the wrong expectation. It's more nuanced than that. But if the brain doesn't have what it needs to function correctly...
Well, I went, and I'll just briefly tell it because I think it's value for our audience to hear. It ties all into this. I went through a period, I had kind of this perfect storm of when I was 48, approaching my 50s, I think I was 48, where I didn't realize I had severe sleep apnea, which was causing me to not sleep very well. And then I had a situation, environmentally, that caused a bunch of anxiety, relationship thing. And this anxiety started to spiral. And then along with the lack of sleep, I started to get panic attacks. I never had panic attacks before. Never, I'm like, what is this? I feel like I'm suffocating. I feel like I'm dying, and then me being the hyper analytical person I am, I'm like, okay, I got to cut out caffeine. I got to cut out alcohol. I got to cut out sugar. And I cut out everything to where, meat is bad for you. You shouldn't eat any meat, and I got and then I'm just eating like kale shakes, and it spiraled so bad that I couldn't think straight anymore. And what I did is part of it, I think, is I was detoxifying so quickly from all these things that I had eaten for so long and done, and whether all of them were good or bad, it's like you say, everything balance, right? So I just dumped everything, but not knowing I had sleep apnea, it just got worse and worse. Long story short, I did get medicated for a little while with some anxiety medicine that helped me at least get back to sleep. And then I discovered, after going in for a sleep test, I had severe sleep apnea. But then I still was sleeping better, but I wasn't feeling right. And then when I came in and saw you, that just totally started changing everything. It was like the finish of what, healing, getting back to, which ties into what we're saying about the SSRIs, depression, all that stuff. It's like, man, my T levels were low. I think when I came in to see you, I was in the 250 or something like that. Yeah, and then more recently, like I said, when I ran out of my supply, I crashed. Didn't realize it until afterwards. I'm like, okay, I see what's going on here. My hormones was way off. So, man, I guess, and this is me saying to my audience, before you go running to the doctor to get anxiety meds and depression meds and that kind of thing, maybe come in and just have a consultation with Dr. Witte and give him a chance to take a look at your levels, right? And just kind of see, hey, maybe we just need to get your body back in balance.
And that's exactly it. We take a look at the levels, we do lab work, and we see, is there room for improvement? Are there ways to help you feel your best? What can we do to provide for the body what it needs so it can serve you your whole long life long? Exactly.
So, Doc, tell me, how did you get started into this? What got you into this? Tell me a little bit about your background, your history.
So, my family's always sort of thought outside the box. When I was very young, I had chronic ear infection, and I ended up with tubes almost 5 times. At one point, my parents, they were paying attention. I'd stayed home from school several days, and then there were several days of snow days living in the Midwest, and I got better. And my parents were like, whoa, what is he being exposed to at school? And so they asked the docs, could it be chocolate milk? Could chocolate milk be contributing to this? Oh, no, absolutely not. It couldn't possibly be Well, long story short, my parents requested that I avoid chocolate milk, and I no longer had chronic ear infections. The combination of the milk and the chocolate was an allergy for me and causing problems.
Really?
So we've always sort of thought outside the box. When I came across naturopathic medicine, I realized, we're trying to do no harm.
Right.
We're trying to make sure we treat the cause. We're trying to help educate our patients so they can make much better choices and empowered in their health. So the principles for naturopathic medicine are just core principles in my life. It was a calling. Fascinatingly, I really wanted to be a baby catcher. I really wanted to be a midwife. I thought I would have a family practice where the grandparents are the parents of babies that I caught, having babies I was still catching. I really thought that was what I wanted to do. When I graduated, there was this really, really fantastic opportunity. I was working for a hormone clinic, and I was pretty opposed to testosterone.
Wait, when you said you graduated, so you did actually go to school to be a midwife?
I looked into the midwifery program at school for various reasons. It just didn't work out.
Oh, okay.
For me to do.
Then you went into naturopathic.
So,
okay.
But at the end of my naturopathic degree, at the end of med school, as I came out, there was this really great opportunity to work hormones. And I'm laughing because I was pretty vehemently opposed. I thought testosterone was cheating.
Right? Oh, yeah, we've all gone through that at some point.
All the dogma and stigma. Within the first 6 weeks of working with patients, they were coming back saying, "Doc, you've changed my life." And so all that stuff, the dogma, the stigma, all that stuff, I just set it on the shelf. I said, how can we do this better? It's what I focused on the entirety of my career. How can we do hormones better?
That's awesome. So, okay, let's dispel a few myths, because one of the major things I hear people say is, "Oh, I'm not going to go on steroids. I'm not doing that stuff." What is the difference between steroids and what you do?
Yeah. So there's this category of molecule called steroid. It is extremely broad. So technically, are things like prednisone a steroid? Yes. So prednisone helps to decrease immune function. It helps to decrease an aberrant function of the body and reduce damage. It's technically a steroid. The molecule of testosterone is technically a steroid. But steroid, the way that our society understands it, it's usually a very strange, either synthetic or an aberrant molecule for the body, done in massive, massive doses for a particular purpose, the purpose of trying to grow more muscle.
So steroid is anything that's, is it always synthetic?
So no, but a bovine version or a canine or equine version of testosterone or an anabolic, those are not normal molecules for the human body.
Okay.
So the treatment that we do, we're doing bioidentical. The molecule of the hormone we're using looks exactly like the molecule the body produces. So there's no allergy to this. You're not allergic to your own hormones. The risks are all the same risks for your body having hormone, which means the body is able to metabolize it and use it appropriately at appropriate dosing.
But would you say then, though, it's not like you're doing hormone therapy, not steroid therapy, like giving people, D-ball and equipoise and these things that are specifically designed.
Those are synthetics.
Okay.
And they are designed as anabolics, and I'm absolutely not prescribing those for patients.
Okay.
Correct.
What about growth hormone?
So growth hormone's an interesting one. It is available to us in pretty substantial limitation here in the U.S. Growth hormone, monthly treatment for patients would probably be just medication costs, anywhere from $3,000 to $4,000. It is just dastardly expensive.
And is that because of regulations?
It's the pharmaceutical pricing.
Interesting.
The pharmaceutical companies, the growth hormone is that the costs have been increasing over the years.
So for a guy like you who does it, over the table, let's say, they make it hard for you for it to be affordable.
Oh, it's extremely difficult. Yep.
But tell me a little bit about growth hormone. Meaning, I've heard it's good for you.
Yeah, so I consider growth hormone repair and maintenance hormone.
Okay.
I know they call it growth hormone. It helps adolescents grow into adults. Really, its purpose in the body is to make sure that we're maintaining the tissues and keeping in good repair.
So you're not opposed to it?
Not at all. Nope. Is there the potential for patients to get into trouble with this?
Abuse it, yeah, like anything.
The old adage, more is better, more is better. No. It's really important that we're providing the amount the body needs so we have excellent repair without this aberrant growth. There are certain organs, so the bowels, for example, will respond to growth hormone, and they do kind of continue growing. Tortoise abdomen, there's a very specific thing where you can start to see the bowels poking out from the abdomen for people who think more is better when it comes to growth hormone. Well, so my approach is something much more safer, much more affordable. Why don't we optimize and improve the body's own ability to produce growth hormone? They're called secretagogues. They're peptides. These peptides are designed to improve the production of and release of the individual's own growth hormone. It's very safe. The body's not going to produce more than it can produce. There are things that have to be in place. We need to make sure that the patient has excellent, exquisite diet, that their sleep is pretty pristine, they're doing everything they can to take excellent care of themselves, they're active and so on, and that they have adequate hormone. But with the right conditions, we can optimize growth hormone through secretagogues. We also have access to IGF-1. So the secretagogues are trying to improve growth hormone. Even with growth hormone treatment, the things that we're measuring in the body, we're looking at IGF-1 specifically, or insulin-like growth factor 1. This triggers the body to go through and make sure that we're doing that correct repair. So in some ways, we can really bypass some of this intermittent signaling and go right to the peptide that the body needs to be able to stay in excellent health. So there's different options, there's different considerations with each of these. I would go through all that with the patient. Peptide treatment would be roughly in more the $400 or $500 a month range as opposed to the $3,000 or $4,000 a month range of growth hormone.
And you might recommend that because that's, as you're saying, if I'm understanding, is going to help with your body's own ability to produce growth hormone.
Correct. It's much safer. In my humble opinion, a more appropriate approach.
When do you stop producing growth hormone?
Growth hormone is one of the first hormones to start declining, and it doesn't go gracefully. It really declines very quickly. That being said, when you look at the ranges for growth hormone, though, they're really broad. Most patients are going to have enough growth hormone that they're still in the range and don't qualify for treatment.
And is there any age variance there?
I would offer it's more individual.
Okay.
Most patients are going to be pretty deficient, especially if they're thinking about growth hormone. My younger patients, it's pretty rare for them to come in the office and ask about growth hormone, for example.
And testosterone for men, when does that start to deplete?
So I've been really surprised. Just like I said, I have my 20-year-olds.
That's not normal, though.
That's not normal, but it's becoming the new normal.
Wow.
It really is. So generally, on the range for testosterone for guys, roughly the 600, 700 range. This is where my guys who are coming in, my pro athletes, my physique competitors, they come in the 600, 700 range and they say, Doc, I'm working out twice as hard as ever. Not only am I not gaining, but I think I'm losing my strength. The 400, 500 range, these are my guys who are coming in, and they're pretty wiped at 2 or 3 in the afternoon.
That was me.
Severe and intense fatigue. In the 200, 300 range, these guys are having to scrape themselves off the couch to come in for the appointment. They really just don't have what they need.
You do something called a therapeutic, and I get that myself. What is that designed to do?
Yeah,
And the purpose?
So hormones are very safe, but there are some things where we can kind of trigger the body, maybe stimulate a little more. So with the testosterone treatment, especially if there's sleep apnea or smoking, the body's sort of starved for oxygen. Testosterone's a potent stimulator then for more red blood cell production. I pay attention to the hematocrit, the percentage of the red blood cells in that total fluid volume. Typically, more red blood cells is a good thing. Better oxygen, better stamina. But if there's more and more and more and more and more and more red blood cells, now there's going to be less and less fluid. Kind of think more dense motor oil, right? So there's going to be an increase in the viscosity. We don't want the pump to have to work too hard.
Which raises blood pressure, or can raise blood pressure is what you're saying essentially.
Interestingly, it's really more in extreme cases where blood pressure would be dysregulated. I don't actually expect increases in blood pressure with this. Okay. But in the research, there's a very small increase in cardiac event. I don't want my guys at any sort of increase in risk. So we're just paying attention to this. We're keeping it in good range. Well, so a therapeutic then, it's very similar to a blood donation. So the donation centers, they plug in, they tap out a pint. Donation centers are able to use that blood for another patient. At this office, though, and sometimes it's just much more convenient to come in and have us do the process. The same process,
right? Just
we're not set up for donation.
Gotcha. Yeah, well, that's quicker. I mean, I do it because I'm on. I don't think you can be on any medications. Really, it's limited when you donate blood, and I'm
Correct.
I'm on a blood pressure medicine, so which is why I come to you, and it lowers my blood pressure after it. I call you guys. I come in and see the vampire. I call it. It's like, all right, take it out. And I don't get lightheaded or nothing. So I've got good thick blood, I guess.
Patients can feel better after doing either donations or the therapeutic phlebotomy, and so it makes sense that there'd be improvements with blood pressure. There's a lot of health benefits with donating. I actually haven't confirmed this. Man, I really need to look at the research on this. But you can reduce your microplastics load by drawing out the blood, doing the donation.
Well, let's say a guy like me who does have, well, I guess thick blood, high blood pressure, right? More blood, red cells, right?
Right.
That's what you got. How often should I get a therapeutic done?
So bodies are all different with this. Even with blood donation, I encourage all my patients to consider doing blood donation a couple, 2, maybe 3 times a year. Some guys do have a little more stimulation for the red blood cells, especially if they're oxygen deprived at night. And so we may do it more kind of 4 times a year. In ultra extreme cases, I've had one patient, he needed therapeutics monthly. There was an aberration with his kidneys. And so it's very, very rare to need that, but just bodies really are different. Depends on the individual. Let me throw it out there as long as I've got here, as long as we're doing the recording. So sleep apnea, the oxygen deprivation while we sleep is incredibly detrimental. So not only blood pressure, but blood sugar, diabetes, and then cholesterol dysregulation, the big 3 killers are all caused by that oxygen deprivation. It's really important. If there's any hint, if there's any indication there might be that apnea, that might be that oxygen deprivation, these patients, men and women are severely underdiagnosed with this. They need to be evaluated for sleep apnea. It's paramount they have that oxygen while they sleep, while the body's trying to do the repair and maintenance.
Yeah, I think there's a lot more people out there that probably need to be treated for sleep apnea than they realize. I know for me, again, the combination of being treated for sleep apnea and the testosterone treatment and the therapeutics are all a normal part of my life now. I've unfortunately, as I've gotten older, I've become very high maintenance. But I mean, you got to do what you got to do, right? And as we get older, I recommend, especially to the guys, both men and women listening, to at least come in and consult with Dr. Witte or one of his doctors about these things, because they really are a huge part of sleep, mental health, physical health, longevity. Again, the doctor's not saying this is me. Pharmaceutical companies and allopathic medicine are more a pill for every ill. Treat the symptoms, not that, or treat things with medicine instead of treating the cause. They just treat the symptoms. So that'd be a correct way to say it. It's more of a symptom treatment than actual. Let's get into the cause of it. And
no shade, but a lot of physicians believe they're treating the cause.
Right.
They're doing their best. No shade, but there are different approaches.
Yeah.
Anything we can do to help keep what we've got. I have a fair number of patients who are like, Doc, I wish I would have come in 5 years ago, 10 years ago, when I was noticing symptoms then. It's way easier as we provide for the body what it needs. We're keeping what the body has. We're keeping that health. We're keeping the body going, as opposed to trying to get back what's been lost.
I think that's a great way to end it right there, Doc.
All right.
So is there anything else you might want to add real quick, just about what are your clinic hours that people can just come in?
So please don't just come in.
Right.
Reach out to us. So our website, ivitalitylife.com. There's the contact information here. We can get you scheduled for an appointment. In Bellingham, there's myself, but I also have Dr. Anna De Corolis working with us. She's doing a really great job helping our women feel their best, keeping them balanced. And she has a little more availability in her schedule.
Well, and before I forget, you have essentially two sides to this business.
So when I first started, when it was me, it was Cedar Male, and then I expanded into the Maidenhair Clinic for women. We've rebranded, so it's still just me. I do have a business partner, Kayleen, that is working with me. I'm very thankful for her help. So it's just the two of us, but we rebranded as iVitality. So.
All right, iVitality. There you go, guys. And if you go in, go ahead and mention my name, Mark Urban. Tell them that, hey, Mark Urban sent you. And as well, you have a system that's still in place that referrals.
Absolutely.
There is a discount. Tell us about that real quick.
So anybody who's coming in as a referral from you, they should let us know that you referred them. If they start treatment,
Right.
you have the benefit. You get $100 off treatment. So
that's great. Doctor, thanks so much for letting
Mark,
us
thank you. I really appreciate being
explain this. I think this is important for everybody to know. Again, this is a growing problem with, like I said, environment, sleep, overall health issues, and it doesn't help. And there's no shame in going in and just saying, hey, I want to get my hormones checked. I'm feeling depressed. I'm feeling anxious. I just can't get out of bed. I can't get off the couch. Come in to see the doc, schedule a consult, and you might just need be on one of his programs. That might just be the thing that helps you feel so much better. Well, everybody, thanks for watching, and until next time, we'll see you soon.